All right, so for those of you who don't know me, my name is Sandy Antunes. I have just recently joined the Darou wellness team. I have been in the hands-on field for quite a while, almost 20 years. I started off as a shiatsu therapist, and about 10 years ago I was introduced to osteopathy, and it just evolved my career. I'm here with my colleague Chris Batten. He is Director of Education at the Institute of Classical Osteopathy in England. And so I'm going to pass it over to Chris, who's going to talk about what osteopathy is.
So, what is osteopathy? First, sort of general points. It's natural, there's no chemicals involved, there's no surgery involved. Hands-on approach to healthcare. Originally, it was perceived as a complete system of health. When the osteopathic movement first started in the 19th century, it was an approach to healthcare through the body with a holistic understanding, using physical methods, physical means to change the body, to change the way the body functions, to understand that there is a distinct relationship between the structure in the body and the way that it works. We used many tried and tested techniques, approaches to restoring and maintaining health. A lot of what we do is centered around the idea of the body framework interacting with the way that it works, the way that it functions, and our work is designed with that in mind, using a series of movements, techniques to adjust the body, to change the way structures relate to each other, to address disturbances in the structural field, particularly the spine. The spine tends to be the center of the treatment process, with the center of the spine, the center of the spinal cord influencing the nervous system and then the nerves themselves. Although the treatment centers around the spine, the actual treatment process itself works throughout the body, as you'll see later, to adjust everything to everything else. One of our sort of remits being that nothing in the body functions in isolation. Everything relates to everything else and needs to be adjusted to fit, to suit everything else. This is very important during pregnancy, the health of the spine, the core of the body for the developing baby, that the baby gets good nerve supply, and also through the nervous system that influences the blood supply to the uterus. We'll be looking at some of the sort of details of the anatomy later, but it's really important to understand this relationship from the external structures of the body through to the internal structures, to the ligaments, etc., that we need to understand about relationships, how forces and so on are working through the body, and how we can actually adapt and change and help a lady to change during the pregnancy process.
So the classical osteopathic approach to the obstetrics patient, it demonstrates a unique way that we address the individual needs of the patient. So in this case, it's the rapid changes that the body goes through that have an impact on its adaptability and function, as opposed to a gradual change with chronic dysfunctions. So we look at spinal mechanics and structural changes that influence the center of gravity, which changes how the patient walks. We look at physiological changes through hormonal influences and fetal demands, which also give insight to adaptations and compensations to the changes that a woman's body goes through during this time, including changes to the body systems, such as cardiovascular, respiratory, renal, GI systems. And we're looking at the intra-abdominal pressures, the pressure changes between the abdomen and the thorax, and the fluid dynamics, how all that it will change throughout pregnancy. So, looking at just the major structure, the pelvis, just to have a better understanding of the changes that occur during pregnancy, it's equally important to know what a normal non-pregnant pelvis looks and feels like. So we know that the pelvis is a structure of transition. It allows complex interactions between the torso and the lower limbs. It works with transferring weight or compression forces from the upper body into the limbs, and it functions with protecting and supporting and dynamically working with the visceral functions. So, major muscles that have an impact on pelvic and hip mechanics. We won't go into all the muscles, but looking at posterior muscles, hamstrings, rotators, muscles that attach to the iliac crest, abdominal muscles. Oh, so here we have posterior muscles, we saw hamstrings, and we see with abdominal muscles and girdle function are very important for the stability of the spine. And it's possible to see how the changing of the abdominal and pelvic tensions in the pregnant patient could adversely impact on the curves of the spine. So here we have some abdominal muscles, and this is something that's common with pregnant patients, the diastasis recti, where the muscles actually separate. So looking at the pelvic floor, it's shaped like a funnel. It forms a muscular sling, so for supporting all of the abdominal pelvic viscera. It also resists increases in the intra-abdominal pressure. And you can also see it in the form of stability of the pelvic girdle and the pelvic floor. So they're interrelated. So here you see. So it's basically like a bowl, and it's supporting all of the structures above. The structure, the stability of the structure itself will have an impact on that pelvic floor. So we know the diaphragm muscle, really important, shaped like a dome between the thorax and the abdomen. You see that respiratory mechanics depend on the interaction of the diaphragm and the rib cage. The lungs, the abdomen, all play an important part in how well these changes occur. So within this big muscle, there are openings where very important structures pass through. And any deviation or any dysfunction within the structure is going to have an effect on how that muscle works and how that muscle comes into play with the structures that run through it. If you think about the diaphragm as like a parachute, and then those guy wires kind of tethered down into the lumbar spine. So then you have your low back that will be affected by the function of your diaphragm. Also, the nerves that innervate the diaphragm come from your neck, C3, 4, and 5. So any kind of neck dysfunction may also have an impact on how your diaphragm works. So you see, it's affected by the intrathoracic and intra-abdominal pressures, and its motion acts like a pump mechanism, which results in alternating negative and positive pressures in the thoracic cavity as well as the abdominal cavity. And so here we see the correlation between the muscular diaphragm, the pelvic floor, the abdominal muscles, and then the back muscles as well, and how they all relate to the stability of the pelvis and the spine, which also relate how well the viscera are balanced. So just touching on hormonal changes and how they affect body function. Secretion of human chorionic gonadotropin, or HCG, is high until about the second month, when it declines to low levels because the placenta sort of takes over and starts to secrete high levels of estrogen and progesterone, which maintains the uterine wall for the rest of the pregnancy. Relaxin inhibits the smooth muscle of the myometrium, or the muscle of the uterus. It suppresses uterine contractions until the onset of labor, and also causes the relaxation of ligaments and the pelvic joints, which it's a good thing, but it can also contribute to joint instability. Touching on parathormone, which helps maintain a high level of calcium in the maternal blood to provide for an increased demand for supplying the fetal skeleton. This becomes even more intensified during lactation, obviously, because the baby requires much more calcium. And then calcium levels are maintained by the increased absorption from the intestines and decreased loss of calcium through the kidneys. So as the volume in the abdomen increases, the pressure of the abdominal cavity rises, and the pressure gradients that change between the abdomen and the thorax alter the venous flow and can therefore cause congestion. So fluid distribution can change with body position. So prolonged standing, sitting throughout the day can result in edema and increasing venous pressure in your legs. But when a woman lies down, the changes in osmotic pressures allow for some of the fluid to return back into the intravascular space, which then results in improved vascular return. So the change from a lateral position to facing up can have about a 25 to 30% decrease in cardiac output. So this can be an important consideration in the treatment methods. So hormonal influences, developmental of placental circulation and changes in the systemic vascular resistance, influence changes such as increased blood volume, cardiac output, heart rate, systemic blood pressure, and distribution of blood flow. So in the later stages, cardiac output may actually decline because the uterus is compressing on the inferior vena cava. The heart is displaced and assumes a more horizontal position as a result of the diaphragm elevation, and then so becomes a little dilated. Maternal blood adapts to the demand by maximizing oxygen carrying capacity, enhancing oxygen delivery to the fetus, and maximizing the effect of blood loss during delivery. So the combination of raised plasma, red blood cell volume increases the maternal total blood volume by about 35%. And here we have just a diagram on fetal circulation. So looking at the lymphatics, we have abdominal lymph from the pelvis and lower limbs, which drain into a structure called the cisterna chyli before entering the left thoracic duct, which is the main duct, and systemic venous circulation. So congestion in this area can be influenced by mechanical, hormonal, or biological factors. So as the intra-abdominal pressure increases during pregnancy, proper lymphatic function depends on the motion of the active respiratory diaphragm and then the passive pelvic diaphragm. So practically all the abdominal lymph from the pelvis and the lower limbs drain into this cisterna chyli before entering the left duct and then systemic circulation. And here we see just an image of the lymphatic capillaries and how they interact with arterial and venous flow. So there's a progressive increase in oxygen consumption with the respiratory system changes. We have pulmonary respiratory efficiency actually increases during pregnancy in compensation for the mechanical compromise of respiration. So this happens because the demands from the maternal heart and the respiratory muscles, as well as increasing metabolic needs of the fetus. The inspiratory and expiratory muscles result in alternating positive and negative intrathoracic pressure, and also create that pumping effect, returning venous circulation and lymph back to the heart. So mechanical factors and biochemical changes interact to enhance the delivery of oxygen and carbon dioxide. And the placenta acts as the respiratory system for the fetus, which provides nutrients and removes carbon dioxide and delivers oxygen. So changes in the gastrointestinal system during pregnancy are related to mechanical factors like the growing uterus, which displaces the abdominal organs and contributes to the increased pressure in the abdominal cavity, as well as hormonal influences, especially estrogen and progesterone. The lower esophageal sphincter is affected by progesterone, which decreases its tone. Along with an increase in intra-abdominal pressure, this can contribute to the development of heartburn during pregnancy. So the increase in height of the duodenal villi, so the projections in the duodenum that absorb the nutrients, contributes to the enhanced absorption of calcium, iron, potassium, and the increase of water and sodium absorption in the colon can contribute to the development of constipation during pregnancy, along with decreased motility of the colon and mechanical obstruction because of the uterus. So constipation can also be a contributing factor. Can also be a contributing factor to the development of hemorrhoids in pregnancy, as is the rise in venous pressure. So during pregnancy, the renal system has an increase in functional activity as the cardiovascular system changes, interact with the alterations in renal blood changes. So we have sodium retention, increased extracellular fluid, and the kidneys also have an important role in the control of the arterial blood pressure, regulating sodium balance, and as well as it serves for the primary excretory organ for the waste that comes from the fetus. So in classical osteopathic, our perspective, the main objective is to free circulation from any obstructions and promote a healthy flow of blood and nerve supply. Limiting restrictions and tensions wherever possible will promote better fluid dynamics, a better physiologic adaptation, and allowing the woman to compensate for these rapid changes more easily. So we look for patterns and tendencies of the spinal curvatures and the overall body position, taking into consideration these factors. We can identify causes for the dysfunction. So not always where the body expresses itself with pain, for example, not always is where the pain is, where the problem is. So we really try to look for what's causing the problem. So rationalizing a treatment plan to relieve the symptoms and then help normalize the structure while preparing the patient for the onset of delivery and labor and delivery is what we try to do with our approach. So in classical osteopathy, we adjust the body adjustment, and we apply it to adjust the structures and all these substances of the body as a whole. So we prepare and engage the tissues, which normalizes the body alignment, removes obstructions affecting fluid dynamics, and restores unity to the body. It requires attention to detail in a routine so that we don't miss anything throughout the treatment. And thereby we establish a certain rhythm throughout the treatment. So its effect is gentle and relaxing, and we tune into the rhythm of the patient. The goal of osteopathic treatment is to assist this natural process, which is pregnancy. It's not a disease. It's a natural physiological process. Now, when things happen too quickly, or if the body was predisposed to things before the patient got pregnant, then we try to help the body adjust in a way that can assist the body in expanding the uterus more evenly, assisting with fluid dynamics so that the patient is more comfortable overall. So it maximizes the body's ability to adapt and compensate for all these changes as efficiently as possible. And so we're supporting both the mother and the fetus with a minimal amount of pain and discomfort. So some of the pelvic dysfunctions that may arise, we have pubic symphysis dysfunctions, which can occur in conjunction with other pelvic dysfunctions. This is me treating a lady with a pubic symphysis dysfunction. It can either be inferior, it can be gapped, inferior, superior, it can be gapped, or it can be compressed. We have sacral dysfunction, sacral coccygeal. If you look at all of the articulations of the pelvis, you have the SI, or the sacroiliac junction, and which a lot of patients that are pregnant complain of sciatic symptoms. And you also have lumbar dysfunctions that can arise because the structure of the pelvis is very much connected to the lumbar spine. So helping the body adapt to the changes that are going on. Thinking of structural changes, how the body tends to make room for the baby, especially with the rib cage. So the structure is changing to allow more space. The pelvis is changing. With all these structural changes, the center of gravity will shift because of the weight in the front, which will affect how the patient walks. And here, just showing the differences that happen with how the diaphragm affects, here, if you see the difference between the diaphragm here and here, how it puts pressure into the thoracic cavity. And another patient. Any questions so far? No? Yep.
When you were talking about this dysfunction, and when you're saying superior, do you mean one of them is on top of the other? So how do you know which, if they're both supposed to be equal, like which determines if it's superior?
They're relative to each other.
Yeah.
One is going to be more superior, the other one's going to be more inferior, but you always adjust both sides.
Okay. But you know what I'm saying? Because if like one, how would you know if it was superior as opposed to inferior if one is misaligned to the other? What's your
Because they would be relative to each other.
right?
So it would be relative to each other. So if this one is higher, this one is relatively lower.
But if one's higher, then one has to be lower. So I'm saying, how would you name it? Like, is it kind of arbitrary? Like, which side you would pick to be?
Yeah,
It's just kind of.
It's also relative to the pattern of the pelvis as a whole, how it relates to the sacrum, because we're observing from behind as well as in front. So
Okay.
we measure it in front, but we're also getting a sense of how the whole ilium-sacrum kind of relationship is working.
Okay.
So, and commonly, it might be a twist pattern, or it might be a shearing pattern
Right.
from falling over at some stage, even before pregnancy. So,
I'm going to pass it on to Chris now,
Cool,
actually.
Thank you.
is it
Yeah.
really,
Yep.
So part of the implication of our understanding of this approach to osteopathy is that it is a holistic approach. It's not just about the physical changes that are going on. It's about the relationship of physical to physiological. Some of the issues that we would consider throughout the pregnancy, digestive issues. Sandy's already mentioned constipation, heartburn. Again, relative to the changing spaces, the pressure gradients, between the thorax and abdomen makes a difference. Again, part of our thinking is also how the spine itself, being the sort of core of the body, the home of the sort of central nervous system and so on, relates to the organs. So something like heartburn, we're looking at the mechanics of how the stomach works, how the esophagus, descending down to the stomach works, but also how the nerve supply influencing that is disturbed. So, for example, if you think about the weight distribution during the pregnancy, you're slowly falling backwards, that there's more of a drag downwards, which in turn is pulling through the fascia, pulling through the soft tissues on the stomach, pulling through the tissues here, and creating there's a tendency for the mother to extend backwards against that. Part of what we encourage is, balanced posture, so thinking upwards and thinking, a nice kind of even balance. Because part of what that does is it creates tension in the upper thoracic spine, which in turn can leave the stomach, vulnerable to inflammation or irritation, and part of the whole pattern of heartburn and so on. So again, part of what we're thinking about the relationship of the sort of structure, the posture, the spine, the spinal mechanics, and the organs themselves. Maybe your patient's presented with stiffness in the neck and the shoulders. A very common thing that we're dealing with in practice is carpal tunnel syndrome. Here we have soreness in the wrists. We have restrictions in the ligaments across the wrist. We have symptoms into the nerves in the hands, numbness, pins and needles, and so on. And again, this is very much a part of our thinking, but thinking in a more sort of global context, if you like. For a start, the nerves for the hand, although they may be disturbed at the wrist, those nerves originate in the base of the neck, or in the sort of middle or lower part of the neck. So again, a lot of our treatment would be local, but also kind of broader, if you like. It would also be considering the fact that part of the reason why there's discomfort in the first place is because there's a lot of fluid in the tissues that adds to the sort of the pressure in the tissues. So our treatment will be concerned about dealing with fluid balance in the body, moving, making sort of the body free for fluids to move around, but also to encourage balance in the mechanisms of fluid balance in the body. So for a start, something like carpal tunnel treatment, carpal tunnel syndrome, the treatment would be a whole body treatment, and thinking about it in a functional sense, not just a structural sense. So yes, we're going to actually sort of work locally, but we also want to think about how the body works in relation to the kidneys, the fluid balance in the body, and so on, and blood pressure mechanisms and so on. So part of what we will be doing will be, the local dealing with the restriction in the neck itself, how that might compress, weaken the nerves, and also in terms of, more specific structural change, right down through to the hand, the wrist, opening up the tissues around the wrist, and so on. In my limited experience, it's something that responds very well to osteopathic treatment because of that kind of global context of treatment and the local side of releasing the tissues. At worst, somebody might have to go in for a surgical procedure to open up the ligaments in the wrist, whereas they can be adjusted manually just to open and relax and stretch those. So whatever a patient comes in with, however we are supporting through the pregnancy, the treatment aims are not just physical. It's about considering the functionality right through a lady's health and obviously the baby's health. Considering the nervous influence, the nerve influence on the blood supply to the baby and so on. So again, you might have the mother coming in at some stage saying, oh, there's concern the baby's not growing fast enough. And so there'll be specific areas of the spine we can actually work with to encourage better circulation, to the baby, so the baby has good nourishment. Obviously, any dietary advice and so on. Of course, our most common thing is going to be dealing with the pelvic and back pain. Increased weight load, as it were, increase of the weight being drawn forwards and down, has a lot to deal with. Often mothers also dealing with other children and so on, creating sort of additional physical stresses that the body has to deal with. So a lot of our work is about decompression. You've got an enormous sort of build-up of weight and pull on the body. A lot of what we're thinking about is decompression. So the treatment is consisting of working through the body, tractioning, just drawing, separating structures that allow for the tissues to move more freely removing the effects of compression, even through the soft tissues, working to counter the draw, the pull, and so on. So a lot of, effectively throughout our sort of work with patients, a lot of what we're dealing with is counteracting gravity in a sense. Of course, an enormous factor on any health condition is stress. And, pregnancy can be a very stressful period of time, especially again if there are other children already present and that needing attention. The body has an awful lot of things to deal with in the state of stress. This is a picture of Mr. Stressed, and an awful lot of things are going on with the influence of adrenaline and cortisol in the body, from the heart response, the accelerated heart response, increase in blood pressure, disturbance in fluid mechanics, disturbance in the digestive system. Digestive system tends to slow down. The body is looking for immediate demands of energy. So it's the body. Naturally, the response is one of fear, fight, flight. So where we have some stimulus that's threatening us, the archetypal tiger entering the room, and the body is kind of going into alert mode and so on. Where that is maintained is what we tend to refer to as stress, this heightened sense of kind of arousal. And when it's appropriate, it's a healthy response. When it's not appropriate, it's not a healthy response. The body doesn't need for the organs to be slowed down. It doesn't need for us to be in a constant state of alertness and so on. So this natural kind of response of the body, whilst it protects us from excessive response to minor injuries, damage and so on in the sort of dangerous situation, this is a finely kind of balanced mechanism, if you like. If we have excessive cortisol being continually released during the alarm phase, there is no facility for inhibiting its excess. So it's very easy to be sort of overloaded with stress, and it being a constant sort of cycle of response and arousal, if you like. So where possible, encouraging the pregnant mother to take time to relax, take time, make space where possible to do so. Part of what we're considering is also there's far too much sort of anti-inflammatory, anti-immune response in the stress response, which again does not lend itself to a healthy environment, does not lend itself to healthy baby development, and certainly doesn't lend itself to healthy balance in hormones. We find that the balance between progesterone and estrogen disturbed significantly by stress. One of the things that I've looked into personally is the whole what's referred to as active birth movement, of encouraging women to be more aware of their bodies, be more aware of using their bodies through the birthing process. I'll talk more specifically about it in a moment. And part of the whole ethos of that is to reduce stress so that it makes a woman more confident, more capable of actually helping herself through the birthing process and reducing the actual stress load that's going through her system. Obviously, it's a frightening time for many people. Cortisol is used as a long-term medical intervention for these very reasons, and the side effects are well known in terms of its disturbance to body physiology. Other side of the equation is, what stress is doing to the body. What is it actually doing on a sort of day-to-day, moment-to-moment basis? Well, for a start, what's going on here? Your mouth dries out. Initial response. There is poor secretion and motility, movement within the stomach, the small and large intestine. There's inefficient absorption, processing and assimilation of food because we're in this heightened response which is designed, if you like, to deal with our safety. So if something dangerous happens, we can run away, we can fight something, we can save the children kind of thing. So our body is keyed for those kind of responses. So again, for everyday health, it is not the most efficient of ways of being. So again, part of our treatment is intended to actually engage that sense of encouraging relaxation in the tissues, encouraging relaxation and ease and comfort in the spine, So that part of what we're doing is bringing down this level of arousal, because it is, as I say, self-perpetuating. The more stressed you get, the more vulnerable you are to stress. And even a good night's sleep very often is not enough to sort of maintain that. And eventually the end result of that is exhaustion. You can't maintain that level of stress without sort of hitting a point of exhaustion. And then part of the whole sort of picture, if you like, is that of constipation. That so often we end up in this sort of picture of everything slowing down and effectively drying out, etc., etc. So part of the thinking in this is this whole kind of naturopathic, if you like, perspective that stress is generally unhealthy, but part of the reason it's unhealthy is that it leads to a relative toxicity in the body. A lot of doctors, medics don't like us using the word toxicity. It's not like we're radioactive or anything. It's relative sort of state of the body's tissues. And I'll explain kind of what that means in this context. Bless you. So a dry mouth leads to inefficient sort of carbohydrate and sugar absorption. Part of what goes on at this end is the saliva and the amylase, the enzymes within the mouth, are helping us to absorb sugar elements. They're helping us to absorb, break down carbohydrates. So if the mouth is dry, that first function is disturbed. Not only is it disturbed, but it's also then, inefficiently broken down carbohydrate then passes to the next stage, which is that of, dealing with breaking down of proteins, breaking down of substance. So again, the stressful lifestyle, we scoff food down without swallowing and chewing properly, or the mouth is dry, so it's not going to absorb properly in the first place. And so we get, the beginnings of an inefficient digestive system. This in itself, poor secretion, poor motility, so that's movement within the stomach, again leads to less efficient breakdown of the food. As this continues through the sort of digestive system, we're not absorbing properly, we're not assimilating properly. Again, in the stress response, there's also a response in the liver that we have this, body system charged, ready to create or use energy as efficiently as possible, but not in terms of breaking food down efficiently and so on. It's just this constant demand for energy and disposal of energy. And of course, by the time we got to sort of constipation and the bowel and the combination of sort of dryness in the system, the stress and so on, we're reabsorbing fluid from our own intestine to save us from dehydration. And inevitably, part of that process, we're absorbing small amounts, obviously, but significant enough amount of waste products back into our system. One of the reasons why anatomically the lower part of the colon has veins going straight back to the liver to help the body to detoxify, on the way out, as it were. So again, part of our treatment is encouraging, ease in the system. It's encouraging comfort, relaxation where possible, but also trying to integrate that within encouraging the digestive system to work more efficiently. So part of our preparing for birth, part of the whole notion of maintaining health in the mother and baby is maintaining a healthy system as a whole, encouraging good balanced way of eating, including the sort of stillness and the right amount of fluid intake appropriate. So preparing for birth itself, what is it we're going to do osteopathically that could make the whole process easier? Sandy was saying earlier, part of what goes on during pregnancy is an increase of hormone that soften ligament structures. I often say to women, this is one of the best times to come for treatment, not to sort of just sort of avoid treatment because the body is changing so much. It's one of the best phases of life to actually have osteopathic type of treatment because it's easier, because you're not dealing with significant restrictions in ligaments, and a woman's body is more responsive. It's full of kind of vitality and life, and more in the process of change and healing and so on. Anyway, when it gets down to specifics, as it implies here, the nearer we're getting to the delivery, we want to encourage a balance between the structures involved, but also sort of these key sort of ligament structures. In fact, specific techniques in osteopathy to release, to stretch and relax some of these ligament structures. One of the things that Sandy mentioned earlier, the whole idea of the fluid dynamics in the body. One of the osteopathic writers describes that part of what we're dealing with in terms of varicosities, and being a man, he describes it, of course, in the most sort of mechanical, unsympathetic terms, and says that the woman's body is acting like a ball valve. What the hell is a ball valve? There's one in the tip of this thing here. There's a tiny little ball bearing that if I put pressure on it, ink dribbles out. Okay? So if you picture a baby engaged in a pelvis, as it grows, as it descends into that pelvis, or as the woman's posture lends itself to collapse, that increases the pressure and reduces the ability of the circulation to return back towards the heart, increasing the back pressure, and part of what builds up the pressure into the circulation in the legs and varicosities. So again, part of our process is to lift and open up not just the pelvis, but the way that the baby is dropping and being drawn into the pelvis. Not trying to counteract what nature is trying to do, but to give it more space. I've got a female colleague of mine who lectures in England on this topic, and one of the main things that she encourages during the sort of preparation for birthing and for during pregnancy is exercising where you're actually allowing the abdomen to hang freely, to counteract this sort of constant down pull of gravity, and also to allow space and ease in that. So either sort of various postures where you're allowing the abdomen to hang, resting, sitting, so you're leaning forwards, allowing this to drop forwards, or even sort of exercises sitting, resting on your hands and knees. That in turn kind of in a sense brings us to this sort of notion of active birth. One of the many sort of things that we're dealing with in trying to encourage a woman to actually approach the idea of birth actively rather than passively is to be in control and to be more at ease with the whole situation as much as one can be in such a stressful kind of situation, but also the practicalities of encouraging the body to function at its optimum. Lying on your back giving birth is not the most logical of things to do, because it closes the birth canal. I think it's 30%, 30 degrees, one or the other. I can never, it's a 30 or something. Which is not the best of things, unless you actually physically want to slow the birth process down. Now, there are times when you'd want to do that. If a woman's had a lot of babies and gives birth rather easily. I've witnessed 3 births, one of which was my sister-in-law, and in total contrast to watching my own 2 kids being born, my sister-in-law gave birth in minutes, and it was like quite scary to see something happening that fast. And it was, for her, it was literally a case of, lie on your side, kind of encourage the process, and there it all was. Watching my 2 children being born, they were, much more reluctant, and they're still the same now, trying to get them out the house in the morning and so on. Bless them. So part of what we're thinking about in this is, as I say, going through stages and patterns of movement to encourage ease and to kind of follow up your osteopathic treatment, which is about gaining movement and balance through the body, gaining space, creating spaces and so on, and encouraging the woman to be kind of more actively in control of this rather than sort of a passive victim of it. One of the whole sort of ideas of our osteopathic kind of ethos in this kind of realm, as Sandy implied earlier, was that pregnancy and childbirth are the most natural things in the world. It's not a pathology, it's not a disease, and a lot of doctors, obstetricians and so on tend to treat it like that, and it's really quite abhorrent. There are a couple of French encountered. guy called Michel Audin and Frédéric Leboyer, and if you're interested in this whole field, they're well worth studying, reading. Very interesting guys. I've met both of them. Michel Audin has run a series of birthing clinics, if you like, and there is a huge emphasis on the woman being comfortable, at ease, dim lights, nice, comfortable surroundings, where appropriate, kind of water birth sort of scenarios and so on. And certainly, encouraging that sense of sort of comfort and ease and relaxation and removing stress. So often, I've been involved in a few births, one way or another, either directly or indirectly, treating women up to and afterwards and so on. And the amount of situations where, for no reason at all, stress is brought upon to bear. My cousin of mine, whose picture you'll see in a minute because I'm treating a baby, set up for a home birth in England. Everything was hunky-dory, everything was fine. Baby starts to appear, waters break, phones up, can't get hold of the midwife. How crazy was that? And so, a bunch of stress, and then ended up in hospital because she's stressed out, etc., etc. It's too often the case. On the other angle of that, one of the things that I found in the UK working was that midwives seem to be the most open-minded of medical people to dealing with sort of complementary healthcare. During the birthing process, I used a series of homeopathic remedies, and between stages of contractions, I had an osteopathic table in the room, treated, and actually went through all this sort of active birth stuff in my own way, rather than following the book, as it were, and helped the process. This is supposed to be a video clip, but it doesn't work. You can find this on YouTube if you want to actually get a kind of visualization of what the birthing process of life is like. 3D animation labour, I think it is. Well worth a look because it's really interesting. I use it for other sort of models in osteopathy of trying to understand how sort of human dynamics and how babies are born with twists and turns in them and so on and so forth. So again, part of what we're doing in this process is encouraging a freedom of movement, but also a balance in the pelvis. Even with every case, every person that we're dealing with, we see the foundation of the spine being in the pelvis. So our body movement center from here to a large extent, how the spine is orientated relates back to the pelvis. How the mother's pelvis evolves during the sort of period of pregnancy depends a huge amount on sort of posture and use of how they're sitting in their pelvis. Another one of the books, one of the books by the French obstetrician, Frédéric Leboyer, is called. He's written two particularly nice ones. One is called Birth Without Violence, trying to understand birth from the baby's perspective and how, again, this sense of ease and so on through the process is going to make nothing but help. The other is another book called The Art of Breathing, and very much concerned with posture and openness during the sort of stages of pregnancy and how beneficial that is to the process. Of course, the other side of the equation is helping mother after the process. So there are things that we can do to encourage breastfeeding or efficient breastfeeding, helping recovery. Both, from an osteopathic perspective and from my own experience, again, using very simple homeopathic remedies. A very common, the most common sort of remedy used, arnica, to help the woman through the sort of shock, trauma. It's useful for anybody, in terms of falls and bumps and shocks and so on and so forth. But it really does, and it's quite well proven to aid recovery. The other, of course, is, in terms of the baby, him or herself. In terms of dealing with colic, there's an awful lot we can do working with babies with colic. Infantile eczema, I've dealt with a few times in babies. Sandy has become quite an adept at dealing with babies with otitis or ear problems, mostly while she's 30,000 feet up in the air.
Come across a lot of babies when I have flights, and in the past year, 4 flights, I was able to help really crying, screaming babies to calm down. rest of the flight.
I bet everyone on that team is
Yeah.
Absolutely. And I mean, very often, mothers can struggle with things like breastfeeding. Again, it can be partially to do with the stress itself. Sometimes it's absolutely basic mechanics. There's a couple of babies I dealt with who I didn't even know that breastfeeding was an issue. In actual fact, I was treating them for something else, and go to sort of just tease out some of the tensions in their neck, and it's tiny treatment. It's like just teasing out this kind of tightness in the neck itself. And part of what you're doing is if you go back a step and you picture what that baby's head is going through. Now we know that the baby's head shrinks because of the fontanelles, but the forces, the enormous forces this tiny little baby has to deal with are beyond measure. And so part of what happens with the baby, if any kind of difficulty or reluctance with the birthing process, is that the upper joints in the neck, from the head to the neck, if you like, become very impacted and torsioned, because the baby, as baby is being born, shame this doesn't really work as a video clip, but as baby is being born, it's a torsional movement. Babies don't just sort of drop straight out. And again, baby has to go through a whole pattern of movements to actually exit. And part of the thing that's going on is that it's obviously under massive compression. So sometimes when babies emerge, their heads and necks are very slightly fixed to one side. So very often you'll hear the mother saying, oh, you'll only feed on one side. And it's like, well, what's that? Is it a breast issue, etc., etc.? No, simply baby can't turn his head to face the other way for quite a while. Eventually that kind of frees up and, it's not such an issue, but initially it becomes, again, part of a stress issue, and baby tends to be kind of, turned in to one side anyway. You wouldn't hold them kind of back to front unless you've got twins. So there's an awful lot we can do, quite simple kind of measures to help mother and baby through the sort of phases of recovery, and also kind of recommending simple exercises and so on. Taking a huge back step as well, in a sense, there's an awful lot we can do to the other end of the equation in terms of dealing with fertility. Sometimes it's beyond anybody's assistant in terms of compatibility, in terms of various different factors. Very often, again, part of what we were talking about earlier, the influence of stress in terms of the female hormones, in terms of male hormones, is really not ideal. So we have our specific osteopathic sort of means of treatment. It may be that the fertility issues arise where we got significant disturbances in the structure of the pelvis, disturbing nerve supply or blood supply or both, to the pelvic organs, means that the organs are not functioning efficiently. Again, it may be something simple as an underlying significant factor of stress, and again, talking through sort of potentials of assisting dealing with stress and so on. And maybe it's just as simple as some basic sort of dietary advice in terms of them being missing elements, or in the partner certain elements are missing. If he's been a smoker, he'll be low in zinc and magnesium and so on, all sort of important factors in fertility for the male. Has anybody got any questions loaded?
In general, or specifically to what you just said?
In general.
Okay. So for example, my name is Martha.
Hi, Martha.
I do doula work and I teach hypnobirthing. And so we often recommend when the baby's not quite positioned correctly. So you had alluded to the fact that the uterus, you can help sort of expand a little more efficiently. Is there any work that you do specifically for repositioning if you have a baby that's not quite right at the time when it should be?
There are various. I mean, you can, baby, him or herself can be adjusted, but very often just adjusting the woman's framework, depending on how, late in this process you're talking about, but by adjusting the pelvis of the lady, adjusting the relationship of the spine to the pelvis, changes the pressure gradient through here, also changes the available space. If baby has got no room to maneuver, it kind of, but again, if you can make a little bit more space, again through exercise, simple posture advice, it can make quite a lot of difference. If you want to. same.
And my other question was, so you had mentioned constipation. What are some other indications or symptoms that you would refer a patient to for treatment?
To come for treatment,
Yes.
any difficulties really. We talked earlier about pubic symphysis dysfunction. The most common thing we're going to get, of course, is people coming in with low back discomfort, and postural. Fluid retentions, blood pressure issues. I had one lady with, I can't remember the correct term, but the sort of diabetic scenario, pregnancy, sort of,
Gestational diabetes?
that's the word.
Okay.
And treatment helped that a lot. It was very interesting actually, because the baby was developing slowly as well, and it was, to us, it's the same area of the spine. There's an area that relates to the liver, also the same sort of nerve supply to the placenta as well. So it's, once you start releasing that, you start getting a kind of kickback from the metabolism and baby development, and it's a very interesting thing. So you name the kind of an awful lot of conditions. There's an awful lot that we can do in terms of if nothing else, giving relief to the sort of the sensation of the body, the sort of the whatever the condition is, reducing it, if you see what I mean, bringing it down in terms of the stress of whatever that symptom might be. So a lot of conditions, awful lot of conditions. I said, I don't know if you caught the bit at the beginning, but osteopathy originally was a whole health treatment. It wasn't just about aches and pains. It was using the body's structure to affect the organic life. It was about treating diseases in the early days, sort of like pneumonia and all sorts of scary things they were treating with just hands-on healthcare, simple kind of measures, dietary stuff, exercise stuff, and it was very effective. Unfortunately, most osteopaths and so on have lost that side of things, and it's kind of disappeared into medicine and so on and so forth. But the potential's still there, and we try and deal with a lot of that stuff where possible.
I'd love to know what your approach is for dealing with colic.
It depends on the baby. Very, very often, what you're getting with a baby is through the thoracolumbar area, an S curve. Yeah, so the spine is curved like that. What that does is it imbalances the nerve supply, the symmetry of the nerve supply, if you like. So you're getting areas that are overstimulated, areas that are understimulated, side by side, and you're irritating the kind of sensorium of digestion, and or kind of kidney function, etc., the kind of balance of function through here. Being as this area is so core to primary kind of movements, the minute you start
Babies' spines aren't S-shaped; they're actually C-shaped.
Yeah. No, I mean
Yeah.
laterally. The curve is I'm talking about laterally.
Not anterior, posterior, actually.
Oh, this way.
Yeah.
Okay.
Part of what happens, see, is
Like this, like that kind of from the side here.
no. Just stand a minute.
Yeah. I just need to visualize.
So we were talking about that.
Oh.
Yeah.
Oh, like that's one of maybe the causes of the colic.
Yeah.
Okay.
Yeah. So part of what we're looking at in terms of the looking at ailments, conditions, and so on, is relating, thinking about the spinal cord, thinking about the spinal and the sympathetic nervous system, and so on, thinking about how that tallies with disturbances in the mechanics, the movement, and the way that the spine is structured. If the spine is particularly impacted, you're getting compression, in and around the foramen, into the dealing with the nerves coming out from the cord. You're squashing blood vessels to and from the cord, not majorly, not just like killing chunks of cord sort of thing, but significantly enough. And early osteopathic research made a really clear kind of illustration of this. That once you start compressing all these structures, you begin to disturb the circulation. That in turn begins to set up several different things. One is just a primary sort of lack of function, if you like, because of there being compression going on. The other is congestion, a tendency for congestion in the cord itself. When you look at the spinal cord, you see that there's more veins coming out. Also, that the veins in and around the cord don't have valves. the rest of the body, all the veins have little valves to stop the blood going backwards, essentially, but around the cord they don't. And so it's essential for health of the spine and the cord itself, and you know, the core of the nervous system, that the spine moves. And when you get significant, you know, compressions and so on, it disturbs, you know, the key functioning in those parts of the cord. They begin to get acidotic. Yeah, so you get build-up of acidity within the structures, which changes the sort of the degree of facilitation, the sensitivity in those parts of the nervous system. So you're getting areas that are oversensitive, you know, overreactive, and areas that are dumbed down or inhibited. So if you imagine that supplying, you know, part of my intestine, that there'll be areas that are overactive, so you might be getting spasms within the colon itself. You might be getting little patches of inflammation. You may be getting sort of like slight malfunction in the sort of kidney field and so on, all of which kind of add together to this kind of nasty, painful kind of condition, and very, very responsive to osteopathic treatment.
So are you doing like a mechanical assessment of the spine and adjustment of the spine
Yep.
to be treating colic?
Yeah.
Okay.
If you want to, have you got a note?
Yeah.
I threw up a video years ago. It's a different scenario. It's the other end of the spectrum. I treated, if we, whoops, close that down. That's me treating my cousin, her baby, with the most awful diarrhea. Baby couldn't hold in for more than a couple of hours. Every 2 or 3 hours, like just like this massive bout of diarrhea. If you look on YouTube, ICO 1956 is a channel. There's 2 videos there I've put up. I've never got around to doing anymore. One is me treating this baby for this most horrendous diarrhea. Now, what was going on was, it was a different kind of process, so it's not talking about colic now. It was very, very compressed in the lower spine. She'd been breech, and not only coming out backwards, upside down, back to front, but also the mother was carrying her in, you know, kind of normally quite healthy, but not in this baby situation, just like a shawl.
Right.
You know, when babies are kind of, you know, scrunched up like this. And it would have been, generally it's not such a bad thing, but when baby has already got a very compressed lower spine, baby ends up, it's going on to some other mode, baby ends up exaggerating that, getting worse and worse and worse. And because that's compressed, in the lower spine here, the sympathetic nerves from this part of the spine if they're stimulated, they have an effect of dampening down. As I was saying, the effect of adrenaline slows down the guts. So the sympathetic nerves slow down the guts by the nature of their function. If you obstruct them, so I've got a blockage in that lower spine, massive diarrhea because there's no dampening down, because you've inhibited that sympathetic function.
Very interesting.
It's fascinating, and it never ceases to amaze me how incredibly responsive babies are to this stuff.
I see a lot of babies who are put in baby carriers for too long, for long periods of time, where either go from the car to the stroller, back to the car,
Yeah.
and so they're in that curved position and kind of collapsing on themselves, where it doesn't even look like a C anymore, it kind of looks like that.
Yeah.
It's true.
Yeah.
And so by addressing it this way, then you're introducing movement into the spine where things can start functioning again.
Part of what we were going to do with this whole process, we haven't got any babies we can demo, but you will see one baby treatment on that little video clip, was to either offer any of you guys a treatment if you fancy, or I'll do a demonstration.
Do we have to be pregnant?
No, not at all. Just willing to be a
We're all probably wanting one, right? We're all probably like, yes.
That's my son.
Can you give an example of the homeopathics you used along the way, and how you changed the remedies?
Right. For both of my kids, they were both reluctant to be born. And there is a remedy called cauliflower, which encourages the birthing process. Interestingly enough, homeopathy and osteopathy alike, it tends to be very difficult to suppress, or to use them in a way that you can with pharmaceuticals. So the reason I'm saying that was my last daughter, my youngest daughter, she was very reluctant in being born. She was trying to come out face first, bless her. And there were a couple of things I did osteopathically to try and encourage the birth. And then there was a few things homeopathically, and both of these interactions would kick in. You would feel the birth beginning to kick in and push through. And then we realized that she actually had the cord around her neck, and it really wasn't the best of things to actually encourage the birthing, et cetera, et cetera. And it was really interesting that both the homeopathic remedy and the osteopathic intervention didn't couldn't be overcoming what nature wanted. And the same with the older child. We really, and there's nothing I could do to encourage birth. If a lady is very sensitive or there's very disturbed sort of vulnerability in the lower spine, it's often said in osteopathic treatment, be careful manipulating the lower spine, which we do anyway, because you could induce birth. I couldn't trying. You'd have to run a small articulated lorry over the lumbar spine to try and get some kind of response in terms of forces involved. So there was that. There is, say, the use of arnica. Arnica is commonly used as a remedy for bumps and falls, post-operative and so on. At different potencies, you can use it in different ways. Most commonly is going to be used after giving birth to help with all the bruising and all the the trauma of the whole process, and also mentally, emotionally the trauma of it. Another whole side to arnica as a remedy, and I say I'm not a homeopath, but it's just stuff that I use in a first aid kind of context, if you like, and anybody can. One of the most important things about homeopathy is that it's not going to do any harm. The worst that's going to bring about is a very strong reaction that you then have to sort of temper with different modalities or different potencies of remedy. The other side of the arnica, which is very, very important during the birthing process, is when the woman hits a point of exhaustion. Arnica is also a very useful remedy for picking up energy, because it's all about kind of energy, the shock, the trauma, etc. It also has the other side of that equation where it kind of solidifies you in a sense. How if you've had a nasty trauma, you're all kind of a bit dazed and sort of in denial and so on. It really kind of grounds that force, if you like. And then there's all sorts of other remedies that help with sort of tearing, anti-septic kind of remedy type sort of processes and so on. So should we do a little bit of a demonstration? Who would like to volunteer? And so on. And regarding the pelvis as again the sort of foundation to everything, getting a sense of the alignment, the ease of movement and so on. Can you just very gradually just bend forward towards your toes? Let your arms drop and just drop down. So trying to get a sense of how the pelvis moves in relation to the spine, getting a sense of the symmetry of movement and so on. So there she's got a slight asymmetrical kind of movement going through there and up again. So nothing major, and the thing is with osteopathic work, do you want to lie onto your back nice and gently?
On my back?
Yes. Is that it's a constant sort of flow from assessment to sort of diagnosis to treatment. Medicine tends to set us up with this procedure where, we take a load of information, we do a bunch of examination, we come up with a diagnosis, and that leads us to treatment. This is a different process. Yes. We start off with the examination and questions, we begin to make a few conclusions, and then we lead to using the treatment process itself to become further information, to gain more information, and to further assess, again, the relationship of structure to function, both in terms of movement and the organs of the body, or in case of the pregnant lady, the developing baby within. So nice, simple, easy kind of movements. Then we start moving arms and legs, into the spine, loosening through the spine. If she was, significantly pregnant, we would then, start treating in the side lying position, because you can't lie a person on the front. Normally, the next stage of the treatment is on the front, but you can't do that with a pregnant lady. So stay relaxed, stay loose, try not to help. It's very important that the patient is as passive as possible, as relaxed, so that movements can be put through, without resistance, without any restriction, if you like. So stay loose, stay easy, just let the leg move. Anything you're uncomfortable with or anything that's painful, just let me know. So then the leg is engaged in such a way that I'm then bearing down into the pelvic joints. Hand underneath palpates, it feels the movement in those joints. So stay very loose and relaxed. So this is enormously valuable in the preparation for delivery, that we're freeing up all these joint structures around the pelvis. Also the sort of, the muscle, and we call the fascia, in and around the muscles that restricts sort of patterns of movement from our posture, from the way we hold ourselves and so on. So as much as you can, letting loose and easy. Nice and easy. Then up to the shoulder girdle and the arm, just making sure the hand is easy and free. Feeling how the movement of the arm just translates, through to the front of the rib cage, through to the clavicle there, getting a feel of how the ribs themselves move, which in turn gives me a sense, relaxed, of how the organs within the chest is working. So the lungs on this side, the liver to some degree, and so on. Also the major sort of vessels in the top of the chest and the bottom of the neck. They need space. If we're constantly holding a load of tension there, you're restricting those, which in turn restricts, where they're delivering blood or removing blood from. So using the arms and legs as levers into the different parts of the body to release restriction, deal with kind of imbalance from one side to the other, from front to back and so on. All the time looking for that sense of ease in the tissues specifically, from one structure to another, but also in patient drop as a whole. So we're trying to gain that sort of ease, turn off all those stress mechanisms, all that adrenaline and so on. Very often patients report after treatment, went home and slept like a log, or children sleep on the way home, etc., etc. Sometimes patients feel exhausted, and it's part of the process of just switching off all those kind of stress and adrenal mechanisms that we all suffer from. And just walking down the street, the noises, the hooting in the cars and all the rest of it, it's constantly the sort of stress factor in our lives. And if we don't find quiet, if we don't find sort of stillness in between, that stress is a constant factor. So be loose, be easy. So by taking the body through these sort of like a pattern of movements, a routine, that Sandy referred to earlier as the body adjustment, we're working right through the body to try and gain symmetry, gain ease, gain release and balance from one side to the other. So I want to make sure both of her legs are functioning in the right orientation, if you like. They're moving freely. They're moving well in relation to the pelvis. That in turn moves well in relation to the lower spine. When we look at the sort of the orientation of the ligaments in the pelvis, again thinking how we could be influencing sort of uterine function, uterine balance and so on. I've treated women before now with prolapse uterus. How on earth can something like this deal with a uterine prolapse? By dealing with the forces acting to that uterus. By dealing with the fact that the uterus itself prolapses partly because of the changes in pressure gradient between the thorax and abdomen. Ideally a uterus should float. It should be floating in there. So should the guts. They're attached, but they should still float. By the time you change the pressures in there, it literally sinks. Yeah. So you wonder why you're getting heavy and congested menstruation when the organ itself is, sat on the floor sort of thing, instead of kind of just nice and buoyant, allowing drainage, etc. So it's surprising what you can do with this stuff. I mean, it's, none of us do miracles, but it is surprising what can be done, and especially, small kids and babies. It never ceases to amaze me, amazing things you can do with them. So drop loose. Treated kids with, the most horrendous ear infections, and, it's resolved in a series of treatments. Kids with eczemas and dealing with teenagers with constipation at the moment. Just sort of, random things. So the leg here being used as a leverage into that low back. Most people's pelvises are not symmetrical. We've typically got a torsional kind of pattern going through. I think partly because of the way that the baby itself is born in a torsional movement. Also, it is said that it's partly because of the asymmetry that most of us very slightly center of gravity off to the right. Partly because the fact that the liver is a large structure in the body. It's not symmetrical. It's mostly on the right over here. And leading less than pure lifestyles, the liver sort of picks up a weight. It accumulates weight. Not a huge amount, but enough to take our center of gravity out of plumb center. Drop loose. That's it. So nice and easy. So just taking the whole body through a series of sort of gentle movements, nice and easy movements, trying to gain freedom in all the tissues, gain freedom in all the joints and so on. Nice and loose. So ribs quite high on this side, so just working to just release a little bit of the tension in between the ribs, so that the little muscles between the ribs, a little bit more ease, and we can encourage those ribs to sort of move more freely. Drop loose. Treated ladies with mastitis. Nasty problem, nasty business. Again, how on earth can you be treating an infection with stuff like this? Very, very responsive. I tell you, very responsive. A friend of mine had the most horrible bloody pain, wouldn't respond to antibiotics. She was absolutely exhausted and in the most horrible, horrible discomfort. Treatment very similar to this, working around, loosening all the tissues around the breast, dealing with the sort of blood supply, to the breast, the drainage and so on, and very light kind of initial treatment, and a very, very, very old remedy for mastitis. Do you know a very, very old remedy for mastitis?
Which one?
Cabbage leaf.
Mm-hmm.
Yeah,
Say cabbage.
yeah, or engorgement, you can use it for.
Yeah. Any inflammation on the surface of the body.
Yeah.
Anyway, did the treatment, had to do that. Next day was like just so much easier. The pain, the real nasty sharpness of the pain had gone, and gave a much more thorough treatment then. Lift your head gently and drop. That's it. And then basically that resolved it. And it was, again, it was quite an amazing process. And, such a nice thing to be able to do. I say it was a friend of mine, and she was in the most awful state. Absolutely awful state. Relax, be loose. So gently decompressing again the vertebra in the neck. Nothing too major. Letting go. So with the work you do on the computers, do you have it all nicely lined up in front of you?
Somewhat.
Because you're very slightly tilting off to that side.
Yeah, that sounds about right.
So try and line up, the computer, the monitor and everything all in the same orientation if you can, and that you're the kind of easy point and everything else moves around you. Same with the mouse and how you position that and use that and so on. So very gently, just teasing decompressing the vertebra in the neck. Let yourself go. Trying to deal with the restrictions in the ligaments and so on. Do you want to slip glasses off a moment? That's a seat. A little bit of work to relax, the head, the scalp, and again, think of the pregnant lady, large amounts of stress if they've got, other children. Just basically this this physiologically, physically kind of relaxes the brain. What we're dealing with, if you were to, I'm not going to do it obviously, take a slice through the head, you'd see a major kind of vein structure through here. So as I work on the surface, even though I'm working on the surface, through the nervous system, through the sort of relationships of the deep and superficial kind of structures in the body, it's helping that structure to relax, release, and dealing with some of the sort of congestion within the brain. Although, we're not talking about some horrible brain disease, we're just talking about the way it functions. This in turn has a really nice effect of relaxing the brain. Very often you get halfway through this and you hear this big sigh. Well, that's nice.
Well, now that you've told me to expect it.
You don't have to. You don't have to play the role. But there is a lot of thinking going on in that head of yours.
Can you feel it?
Yes. It's tension. It just manifests as tension. People that are very mentally kind of either, a lot of mental work or, mentally stressed. So thinking, worrying too much mentally creates a massive tension around the head. And like the whole sort of stress scenario, it becomes a bit of a vicious circle. The more tight your head is, the more vulnerable you are to stress.
Probably irritation too. Like a Doberman, how they have those big brains and a little skull.
Yeah, absolutely.
Yeah.
I mean, this is one of the issues about brain disorders, about conditions like meningitis and so on. One of the biggest problems is the fact that you're in a closed shell here. Okay, there's little tiny little holes here and there, but you're in a sort of an enclosed space, and any significant change in pressure internally is met with resistance of the walls. So there's no room for inflammation to occur or to expand. Somewhere else, shoulder problem, you get the tissues expanding and inflaming, massively, or you bruised something. Your brain and all that stuff inside, all the sinuses and so on, there's nowhere for it to go. So it just gets more and more painful and, throbs with the pressure of the blood going through it. And when you bend over, you increase, the pressure in the brain and so on and so forth. A little traction, just drawing, decompressing again through the neck into the upper spine. Little movement through the shoulders. Effectively, it's doing various things, but one is to acting like a pump. There are major blood vessels under here, and we're just providing a kind of stimulus, like a pumping mechanism, which again helps to decongest the brain and also draw through the lymphatics, the sort of fluids in between the blood vessels, away from the head again. Can you slowly turn onto your front? Do you want me to grab your glasses?
Sure, thank you.
That's it. I'll put them over here somewhere on the chair. Do you want to let your arms drop over the sides? Stay nice and loose and relaxed. So again, movement through the legs. Combination of things going on. One, I'm looking at the movement through hips, knees and ankles into the low back. How do those relate? How do those move? It's also a pumping mechanism, so I'm also encouraging the circulation to return up through to the heart. Obviously, as I said, we can't be treating a pregnant lady on her front, but we can do all these movements that assist the circulation, either through, circular movements or similar movements to this, that help to, begin to take the pressure off, varicosities and so on. a lot of this you see is rhythmical. There's a nice kind of rhythmical movement going through. That in turn helps to relax. It also helps to encourage the nervous system to sort of pick up this kind of uniformity of stimulus, of rhythm, which in turn works, through the nervous system to unify the sort of tension patterns and restrictions and so on in the body. It also appeals to higher centers. There are what we call the limbic centers in the brain, which are concerned with a lot of different functions, but also tie us up with sort of, the kind of harmony, the sort of, on a sort of social level of kind of acceptance, of feeling like you belong somewhere and so on. And this kind of rocking movement is actually quite important in that. In the same way, baby wakes up in the middle of the night, you're not going to shake it back to sleep, are you? You're going to sort of rock gently or walk around or sing or at worst go for a drive in the car, take the stroller out. It's all about rhythm. So we're appealing to the structures, loosening them up with a nice kind of easy movement, but at the same time appealing to the nervous system by giving it this nice kind of soothing rhythmical movement. All the muscles like it, all the joints like it, and so on. Very easy. So using this, when we're using the arms and legs, a lot of what we're doing is using them as a leverage. So I'm using that as a lever to move the thoracic spine, to release the tensions, between the shoulders here, and so on. Feel a bunch of stress there too.
I was just going to say, that actually, not that it hurts, but I can feel it in the muscles.
Yes, I can feel it in the muscles too. It's irritated up here. I can do with some de-stressing.
I don't like that.
When are you due for a holiday then?
Not until October. It will get much more stressful before it gets better.
You need to grab a weekend or something at least. Trouble is, stress is self-perpetuating. The more stressed you are, the more vulnerable you are to it.
Mm-hmm.
Even just stopping for 5 minutes on a regular basis. Stopping, just pause, put your feet up, breathe. Give yourself 5, and then start again. You think you haven't got time for it, but it's the one thing that will make you more efficient and more effective.
I agree.
Slowly turn face towards the screen. No, just your head.
Oh, just
That's it. Nice and easy. So as I say, when we think about this on a physical level, think about it also that, all this movement is also translating through to, the nervous system. It's also translating through that to the organs. So where we've got restriction or irritation, we've got two poles of the organs, the body being overstimulated or understimulated. Things are not moving effectively enough. And that can manifest in all sorts of ways in terms of the backgrounds to diseases and disorders in the body. It's a very different way of understanding, how diseases and processes work in the body, but to a very significant extent, it's very effective. So particularly with, the things that we're talking about today with pregnant ladies and with small children. Obviously, the treatment of a small child is, is a different process to theirs. As I say, if you look at that website, you'll see, or that YouTube thing, you'll see what a baby treatment looks like. They usually cry, bless them, because they don't like being mauled around. I've got a colleague that won't treat them if they're crying, and it's like, I don't know how you could actually do that. Because so often when they come to see you, they've got colic, they've got, pain somewhere or another. So they're in discomfort. Unless you treat them like attached to the mother's breast or something, which is not impossible. Sometimes you have to do some odd things.
Can I ask a question from this vantage?
You can.
Is there any, I know there's homeopathic and naturopathic protocols for allergies. Do you guys have any such corresponding treatments?
As ever, treat what you're finding. The thing with understanding allergies is understanding the mechanism behind it. When we look at allergies and so on, we tend to see that as a kind of body's inappropriate or exaggerated response to something. So if you read the textbooks on asthma, it'll say that asthma is caused by an allergic reaction causing bronchoconstriction, blah blah blah. Well, not from our perspective. It's not. Those are the results of the disorder. The system is oversensitized, and it's oversensitized. It can be oversensitized for a number of reasons, but usually, typically, it's through the nervous system, that the nervous system is making those areas oversensitive, and so you get inappropriate kind of immunological reactions in the tissues, partly mediated through the the nervous system itself, because it's facilitated or irritated. If that wasn't the case, I wouldn't have been able to have treated quite a number of kids with asthma and who no longer have asthma. And I don't mean it's just a bit easier. I mean they don't have asthma. It's gone, finished. So if it was if it was purely an allergic type thing, again, how on earth could treatment like this actually do anything for them? It's recognizing that there is there are mechanisms behind. Sometimes it's multi-layered and it's very complicated. And sometimes it takes forever to resolve things. But small kids with asthma, not in my experience.
So how does that relate to food allergies?
Again, a lot of it depends on the nature of the stimulus to the digestive system. Sort of gluten allergies and so on. There are those that would say that a lot of the wheat and gluten products that are available are not the healthiest of things anyway, because of all the petrochemicals that are splattered all over them, and odiously poisonous at that. And wheat is very vulnerable to absorption of the pesticides that are sprayed all over it. And then you can also say that a very stressed sort of small intestine becomes very vulnerable to kind of permeability. It becomes more permeable because of sort of weakness, because of the sort of stress response in itself, and as such, your body is absorbing, inappropriate amounts of gluten into the system, which the body then reacts on and creates a kind of not exactly an allergic response, but an immune response to stuff that shouldn't be there in the first place. Same once you're desperately constipated, that your body is reabsorbing waste and you react to it, your system reacts to it. Nice and easy.
So you were doing some inhibition on the left side?
Both sides.
Left side?
Both.
Or both sides?
Try to de-stress. Go home and flop now.
Much sympathetic.
At least that's what I'm hoping. Don't flop in the car on the way home, though, will you?
Yeah, well, I'm taking the streetcar. That might even be worse.
Yeah, well, keep an eye on your stop. Huh? Where am I? Done that before now. So very gently lie on your left side. So part of the whole understanding of this sort of approach to manual medicine, if you like, is understanding the role of the pelvis as a foundation to the spine. And so it's very important in our work, both diagnosing but also treating, balancing, leveling the pelvis. So I'm just feeling through the movement in the lower spine to feel how that relates, from above down and from below up, to understand how to actually best release the sort of tension pattern through here. Very gently push your bottom leg straight and the top one loose. So taking various forces, through the pelvis, I'm trying to isolate sort of some tension in the sacroiliac joint there, which is part of the whole sense of the pelvis as a foundation. Very gently torsioning down, so taking the tension from above down to that. Leg coming over the side, and then very gently just allow the leg to fall. So using a combination of forces to prise things open, to tease some movement in some of the structures. And using, creates quite a bit of force, but applied gently. So a lot of force applied gently. Nice and easy. And loose. Can you swizzle that way, just so that they can see, again, kind of what I'm doing. So same again. Bottom leg out straight. And the top leg loose. So I'm feeling through the lumbar spine, so I'm getting this leg oriented towards the lumbar spine so that the leverage will have its best effect through here. And the bottom leg nice and straight, so it's maintaining a tension through the pelvis. Stay loose. Can I have this one? I only want to borrow it. You can have it back. So let the leg come gently over the side. So same again, it's taking a torsional movement through the pelvis, decompressing, and just making a little kind of adjustment through the movements there. Would you like to sit up nice and gently, face towards me? So where we had that compression at the base of the neck, we're just trying to deal with some of that now. So arms up, drop your head forwards onto your arms and lean. Just lean on me. So again, using a leverage, so the arms, head and neck as a lever into the base of the neck. So just let yourself rest. That's it, lovely. It's an easy movement, there's nothing traumatic about it. Typically in osteopathic treatment we do kind of manipulation, but it's nothing like, forceful or too violent. There are times when, when you have to move joints, if something is really stuck and you need to move some joint structure because it's creating too much discomfort with somebody. But a lot of it is this sort of gentle, persistent movement, coaxing change rather than forcing change. And again, if we were dealing with a pregnant lady, the ligaments and the body is generally more responsive anyway, so the use of force is pretty much obviated. So lifting up. So similar thing, but over my shoulder this time. So fold your arms. And then lean. So taking that same movement a little bit further down by a different leverage. So just really lean. That's it, lovely. So just taking those vertebrae where I'm locating the movement through very simple pattern of movement, just flexion, extension, sometimes a little side bending and rotation where it's a little bit restricted. So basically taking most of the body through just simple, easy patterns of movement. Trying to restore, where the movement is diminished. Trying to loosen where there's tension. Okay, hand up gently. So just stay as you are, where you are. One more thing, head down. And then very gently, just finishing off with just a nice loosening movement that kind of unifies the change that we're bringing about. And at the same time, further assesses, to see whether any more is going to be needed in this particular session, or, whether it's a good idea to get you in next week and follow up as best is served. Okay?
Thank you.
Glasses.